Okay, let's look at the humerus. This is of course the big long sturdy bone of the arm, and it articulates with the scapula superiorly here at the head and with the radius and ulna at the lower end of the humerus. And here you can see the head is actually made up of part of a sphere. It's about half of a sphere, and you can see it has smooth surface for articulating with the glenoid cavity, and it's got a anatomical neck which runs around just at the edge of this articular surface, and it's got that separates the head from the shaft, and we can see here the lesser tubercle and the greater tubercle. The position of this bone is such that the head is directed medially, so this is the medial area here. It's directed superiorly, and it's directed slightly posteriorly as well. Look at the humerus in an articulated skeleton and you'll see what I mean. So the greater tubercle is lateral and covered by the deltoid muscle, and this is the lesser tubercle, and you can see the intertubercular groove lying in between for the tendon of long-headed biceps. The tubercles are the insertions for the rotator cuff muscles, which surround the head like so, and you've got the subscapularis, you've got the supraspinatus, the infraspinatus, and the teres minor, like so, and they grasp the head and form a cuff. Now you can see that below the head and the tubercles, this area here is known as the surgical neck, and that's because that's where it fractures most often. It's also important clinically because the axillary nerve winds round the posterior part of the neck here, so it goes from anterior to posterior and winds round, supplies the deltoid and teres minor, and that's vulnerable in dislocations of the head of the humerus from the shoulder joint. And if you look at it, there's also a big V-shaped rough area here, which is for the deltoid insertion. It's known as the deltoid tuberosity, and there's a smooth area in the bone there just behind that groove. See, you can actually almost feel it better than you can see it, and that groove is for where the radial nerve runs. Again, from posteriorly it winds round the humerus, round here, and it comes down the arm. So you can see the shaft of the humerus here, and at its lower end it's got a medial epicondyle, which is much larger than the lateral epicondyle. The lateral epicondyle is here, and you can see it's got two articular areas, the capitulum for the head of the radius and the trochlea for the articulation of the ulna.